Hello, I'm Sarah Menz. I'm a nurse practitioner with Centennial Health at our El Reno location. Today, I'd like to demonstrate to you the proper way to take your blood pressure at home. This will assist with our increased use of televisits. For when we do televisits, we do ask for your current vitals. This can also help to prevent you having to come into the office for simple visits such as a blood pressure check. So, there are a couple of factors to consider before you take your blood pressure at home. First of all, it's best to sit in a quiet area with both feet on the floor without your legs crossed. Give yourself a few minutes, 2 to 5 minutes, to kind of calm down after you've done an activity or before you move on to something else. There are 2 different kinds of blood pressure cuffs that are typically used in the home for you to check your own blood pressure. One is a wrist cuff, or another is an arm cuff. The arm cuff technically gives probably a better reading for your blood pressure, but sometimes those are difficult to use. So I'm going to show you how to use both of them. As long as you're using the same machine consistently, that should give us an idea of your blood pressure range and changes. So first we'll do the cuff blood pressure. This one goes on your wrist, and you can follow the manufacturer instructions, but typically you'll put the face or the reading of the blood pressure cuff on the inner wrist, fasten it snugly, and then just push the on button. It should start. Make sure that the screen lights up, and then just gently hold your arm over your chest like you're saying the flag salute. It's best to not talk while you're taking your blood pressure, so if you can sit quietly with both feet on the floor, that will give you the best reading. And you just wait for the blood pressure cuff to finish. Typically it stops pulsing when it's done. And then when it's finished, you can look at the reading. Then you will record the systolic and diastolic numbers. So the top number is the systolic, the bottom number is the diastolic. Most of these also have a pulse recording, and you can use that as well. Now, with the arm cuff, same rules apply. Try to sit quietly, both feet on the floor. And as I said, this one's a little more difficult to apply for yourself, so you may have to have someone help you. But the general idea is to make sure that the marking or the dot on this cuff, which is typically right by the tubing, is located just above the bend in your arm. So if you can get it right there and then tighten the cuff as well as you can to that area, then just relax your arm on a tabletop, desk, or in your lap. Push the start button and sit quietly while your blood pressure is taken. It's important that you are relaxed and try to remain quiet while your blood pressure is being taken. And then same for this recording, the top number, the systolic number, and the bottom, the diastolic, you'll record those as well as your pulse. I hope this video helps you feel a little more comfortable checking your own blood pressure and is useful when you need to use a televisit through Centennial Health. We appreciate it, and if you do have any questions or need any assistance, please feel free to call one of our offices. Thank you.